Next, please. The next case is the 62-year-old female patient suffered rheumatoid arthritis for about 37 years. Also iron deficiency anemia and toxic liver damage. And this is my detoxification program. I treated her, but without Gcmaf in the first 2 months. When I decided to take the Gcmaf, the treatment without Gcmaf wasn't very successful. But after the first Gcmaf injection, 100 milligrams subcutaneous in this way, in this patient, the pains are much better, and now after 5 months treating, she has no pains in her joints. The next, please. The third description or the third case, the cases are patients with acute infections. The first, it's a 55-year-old male patient with flu-like symptoms, fever, and the other patient is a 25-year-old male patient with similar symptoms. They got this program only a single shot, 100 and 200 nanogram Gcmaf, and all symptoms are away the next day. And therefore, you can treat or can add your treatment of acute infections with Gcmaf. Next, please. Results of cancer treatment. We must be careful. Yeah. This means we have 20.7 or 21.7 patients of stage 4 patients lost. Next. And if we look at the
79% survival.
Okay. But it's only the time from November 2011, and we have no 5 years survival rate. Yeah? We must be careful. What many or some audience members might have evidence-based medicine. We can't do evidence-based medicine with Gcmaf. We have no experiences over 10 years, 15 years or longer. Yeah? Only we can describe experiences in this short time. From the 62 patients which are treated with my new regime since January 2003, on between twice a week, 200 nanograms intravenous, I've told you, only 2 patients died, but are 3 months. Please be careful. Okay, the next, please. The patients in my ambulance are very particular because the most of them are considered incurable by the normal or school medicine. And therefore, amygdalin and mibroben and Gcmaf are, we call it ultima ratio therapy. That's the first remark. Next. Considering the various full-blown clinical pictures of iris reactions, immune reconstitution inflammatory syndrome, we have heard about it this morning, the question rises if one should start therapy with homeopathic conditioned Gcmaf when suffering advanced stages of cancer 3 and 4. I think we must discuss this because I have some patients with very heavy reactions, very strong reactions, and then we must go down with the dose. I think to start in some cases with the homeopathic Gcmaf may be a solution. The next program, and the next. The characterized capillary receptor cell saturation, respectively activating concentrating of macrophages, you know the study, might in vitro be correct and true. However, law of nature in vivo reacts differently, and the optimum results and validities are learned when you are doing by try and error while treating your living, suffering patients. Certainly, there are individually optimizable dosages of different sufferings, while type and degree of the disease, in my opinion, are very important. Altogether, I had very good results giving 200 nanograms Gcmaf twice a week. Considering vitamin D, my experiences have proven that the approximate value of folic from the year 2007 definitely are scheduled too low. Target value of the 25 OHD level of the serum concerning cancer patients would be upon 150 and 250 micrograms per liter. I've seen patients with serum levels more than 500 or 800 micrograms per liter without showing any signs of intoxication, no signs of hypocalcemia or no signs of nephrosis. Don't fear to go up with your vitamin D. I think there's a large field of different kinds of therapies with Gcmaf in future times, like Lyme disease, we have seen, or all inflammatory infiltrated sufferings of the skin, the joints, and the gastrointestinal infections. Also, very interesting results can be achieved in psychiatric neurological fields. It definitely is no universal remedy, and the patient always must be considered as a holistic, integrated system and should be treated accordingly to this. For that matter, therapy should go along with highly closed micronutrient automolecular substances, and particularly severe detoxification or target-oriented antibiotics or to molecular therapy. Altogether, I do not have experienced any limitations by treating with Gcmaf in combination with other substances. Worldwide, is the combination of the natural chemotherapeutic substance and actually. At last, no, we have no time. The next, and I thank you for your attention and experience.